Osteoporosis is a disease that can cause serious fractures and change a person's life dramatically. Dr. Christy DeSapri is a specialist in prevention and treatment of the disease, and she is here to tell us more and provide some guidance. Good morning.
Good morning, Angie.
So what exactly is osteoporosis?
So osteoporosis is an important condition, particularly for midlife women to understand. What does this mean? So osteoporosis is a condition of lower bone mineral density or weakening of the bones and the bone, both bone density and both strength, which increases the risk for an osteoporosis-related fracture. And those fractures are generally fractures are from a standing height or less, such as a wrist fracture, hip fracture, spinal fracture, a forearm fracture, or leg fracture. And most of these fractures have significant consequences that we can impact, and that's why we're here to talk about osteoporosis prevention, diagnosis, and treatment today.
Who are the people in our population most at risk?
So when we look, we know that 8 million women have osteoporosis in the United States that we know of, and 2 million men. So there are various risk factors for having low bone density or increased risk for fracture. Those start with looking at our genetics. We know that our bone mass can be inherited, so looking at family history of osteoporosis or fractures, being female, the age of menopause, primarily early natural or surgical menopause, increases your risk for osteoporosis because bone has been lost after estrogen or hormones at midlife. Certain medications, medical history, surgical history can increase risk for osteoporosis. So really important, again, at midlife to understand osteoporosis is common and we can prevent the fractures I mentioned, but important to know what your bone health looks like at menopause.
Are there some misconceptions out there about osteoporosis, and what does that cost women if they don't know what the facts are?
There certainly are. So that's why I'm working with Amgen to raise awareness about osteoporosis, because osteoporosis is a silent condition. Many women have osteoporosis and are not aware until they have their first fracture that the bone mineral density has been lost and they're at high risk for a fracture. The other thing that is not understood is that 20% or 1 in 5 women who sustain a fracture of, like I mentioned, the forearm, hip, spine, are at increased risk for having another fracture within the first 5 years. So 20% will have another fracture, and that risk is even highest in the subsequent years following. What fractures mean are oftentimes can really change the course of women's lives. I've seen this in my clinical practice all the time. Fractures can cause pain, problems with mobility, problems with living independently again, and even affect lifespan. So when we think about osteoporosis, it's not an inevitable part of aging. There are a lot of things that we can do to prevent and treat fractures, starting with knowing your risk factors, obtaining a diagnosis of osteoporosis with obtaining a bone mineral density screening test, which helps evaluate bone density and bone strength. And if you have sustained osteoporosis or have a diagnosis of osteoporosis, really doing something to evaluate and treat that so we can prevent these fractures that I mentioned.
Can you send my viewers to a website where they can learn more?
I can. So for postmenopausal women with osteoporosis who may be at risk for osteoporosis or have sustained one of those fractures, who want to take a more proactive approach, there are various resources I recommend to my patients. One of them, a website, understandop.com, is where you can go to learn more information about osteoporosis as a condition, how you can talk to your clinician or healthcare provider about osteoporosis if you are at risk, as well as talk about osteoporosis medications that are FDA approved, safe, and effective if you've sustained an osteoporosis-related fracture or at high risk.